I'm Cindy, and I did an interview with Ashton Underwood, who is a diagnostic medical sonographer and the owner of O Baby Ultrasound and Boutique, which is in Murfreesboro. For some background information, Miss Ashton Underwood's clinic specializes in baby ultrasounds, and they only have around 8 sonographers, so it's a pretty small clinic. So thank you to Miss Ashton Underwood for allowing me to interview her. But the first concept I'll be looking at is communication competence, and this is the ability to effectively communicate to the other person in a conversation, and it requires that person to be an adaptable and effective communicator. And so this applies to sonography because it's an area that specializes in creating images inside the body, so it's pretty complicated and there's a lot of information that a non-professional person would not understand. So when you have to work in such a clinic that requires you to explain these images to other people, you need to have communication competence to explain these ultrasound images to patients. And so I asked Ms. Underwood how she goes about this issue between sonographers and patients, and she said they have to learn how to simplify these concepts that are shown in the ultrasound images, and that they also use the computer screen that displays the ultrasound images and points at the areas that they need to explain to further the understanding of the patient. And so I asked her if communication is important in sonography, and she said that of course it is, because of what I said earlier, but also because that it's a clinic that specializes in baby ultrasounds. And so there's going to be like first-time parents, first-time mothers that go there. And so it's important to explain to these patients that are new to parenting and new to being in an ultrasound clinic. The second concept I'll be looking at is being other-oriented, and this is the ability to consider the other person's feelings, emotions, experiences, and more when you're talking to them. And so in sonography, especially a clinic that specializes in baby ultrasounds, there's going to be a lot of emotions, mostly happy ones because people are excited to see their baby. But she did tell me there are bad emotions when they have to give bad news about the baby status. And so I asked her how she deals with both of these circumstances, and she said that she tries to change the tone of her voice and tries to match the mood of the other person. And she said that she also considers the music of the clinic, and she changes it to happy music when she needs it or calm music when she needs it. And I think that considering even these small details like changing the music is important, because it definitely helps to calm down patients that enter the clinic who may be first-time parents. And because the clinic is small, music can set like the overall mood and tone of the atmosphere. So it's definitely important to consider that when being other-oriented. And so communication competence and being other-oriented is important in sonography, and they make sure that effective and sympathetic communication and conversations are happening in this area so that both parties, the sonographers and the patients, can understand what's happening. And thank you for watching, and thank you again to Miss Ashton Underwood for allowing me to interview her.